Hello everyone, my name is Amelia. I am a freshman at GU, and today I will be talking about healthcare in the United States. Now, it is a known fact that healthcare is a major issue in the United States. Over half the bankruptcies are due to medical costs, and that number has slowly risen over time. Our GDP outspends other developed nations on healthcare. In fact, Germany, the nation that spends the second most on healthcare, spends 11%, compared to the US, which spends 16%. Some people even put off much-needed preventative and medical treatments in order to avoid the medical costs. Now, single-payer healthcare may seem like a radical idea. However, historical precedent has shown that it may work in the US. For example, in the 1960s, Medicare was considered radical. However, the policy was able to be enacted and is efficiently working. The Affordable Care Act, which was enacted in 2010, is also seen as a little extreme. It was a step towards single-payer healthcare, and it insured over 30 million uninsured people. However, neither of these policies are enough. The Affordable Care Act leaves out some 30 million Americans who are still uninsured, and Medicare will soon not be enough. The population of elderly people is expected to make up 19% of the US population by 2025, which will put a great strain on Medicare, the costs of which are already rising. In order to solve the problem of healthcare, we clearly have to take further steps. My suggested solution to this is that we implement a policy of single-payer healthcare which is mixed of public healthcare and private healthcare at the state level. This will mean that states are able to decide what type of healthcare policy works best for them, how much they want to be public and private, and furthermore, the solution of public and private healthcare will likely fix our healthcare problems. Countries with single-payer healthcare have to pay far less in healthcare costs than the United States. Furthermore, adults often do not postpone medical treatments, so they are able to get the necessary medical help they need. The amount of bankruptcies caused by healthcare in Canada, which has a single-payer healthcare, is 12%, much lower than that in the United States. However, there are arguments to be made against this solution. Single-payer healthcare will, obviously, cause an increase in taxes. Furthermore, it may lower the quality of care we can get. The US has a very excellent quality of medical care, when we can afford it, of course. However, not all countries are so lucky. Scotland, which is an entirely public system of healthcare, has a crisis with their healthcare problem. Some patients have to wait up to 12 weeks to receive care, and cancer patients have to wait up for 8 months to start treatment. The disaster of healthcare in Scotland, for some, creates a grim picture of what our healthcare system may be in the US, and not without reason. Research has shown that systems that are entirely public healthcare cause progress in the system to stagnate. These problems may seem terrible, however, they are avoidable and may not be as bad as they appear at first glance. Experts estimate that taxes under a single-payer healthcare system will only increase by about 3 to 4%. Obviously, no one likes an increase in taxes, but the amount is small enough to handle and reasonable. Furthermore, premiums may likely go down or disappear completely. Additionally, though our system of healthcare is good, Americans are clearly not benefiting from it. As previously mentioned, many adults put off much-needed care. This happens far less in developed countries with single-payer healthcare. Furthermore, developed countries with single-payer healthcare have longer life expectancies than that of Americans. The quality of healthcare in Canada is just as good as that of America. However, Canadians on average live about 2.5 years longer than Americans do. Clearly, their quality of healthcare is greater. Furthermore, research shows that a mix of private and public healthcare, which is what I suggested for my proposal, provides the optimal care. State-mandated single-payer healthcare will resolve the U.S. healthcare problems. Evidence of other countries' progress shows that countries with single-payer healthcare have to pay less for healthcare costs, both at the government level and the individual level. Furthermore, individuals are more likely to seek care. Thank you for watching.